feels really overwhelming. The number of things that keep coming down the pipeline of ways that our community is under threat. Um, and so one thing we do at Senior and Disability Action is we look at some of those threats and we pull together a bunch of people and figure out a plan about what we can do about that. Um, and one of those threats that we're trying to tackle is the threat to Medi-Cal and home and community-based services. Um, and basically, yeah, so we have legislators in Sacramento who are making decisions about whether our healthcare gets funded, whether healthcare for immigrants gets funded, whether our IHSS in home supports and services gets funded. Um, and so we're going to talk about today about like what is kind of at risk and what are some of the things we can do about it.
So,
Um, and we're at kind of a unique opportunity today because we are here just in the past week or two. We had a pretty great news coming out of the Senate that the Senate is with us. The Senate believes that immigrants should have health care. The Senate believes that in-home supportive services should not get cut. Um, but we're not going to win unless we can convince the Assembly, which is the other half of California's legislative body. And so one of the things we're going to do today is reach out to some of the people who have the most power in the Assembly.
Thank you, Shaya. I wanted to maybe pause here and see if there are any questions so far. I know we're pretty early on, but just to get myself in the habit also. Okay. Okay. So let's talk a little bit about who and what does Medi-Cal cover in case you aren't sure, you don't know. And it's really important that we do this work to defend Medi-Cal and these services because Medi-Cal covers many, many different forms of healthcare, and almost 40% of Californians are on Medi-Cal. So that's close to half the state. Um, Over 7 million seniors and 10 million people with disabilities every year receive Medicaid. And it also helps over 12 million people with Medicare access the care they need in order to bridge a gap. And the graphic that is being displayed right now talks a little bit about some of the services that Medi-Cal covers. Some of those services include in-home supports and services, but also children's medical care like dental care and eyeglasses, and even speech therapy, assistive tech, mobility aids, but also even regional centers and independent living services are included in that budget as well. So cuts and changes to the coverage that provides medical care that affects seniors, disabled people, low-income people, immigrants, and young people. It would affect a lot of people. So it's important that we defend Medi-Cal by sharing our stories and advocating with our legislators. So let's talk a little bit about what changes came out of last year and what is at risk right now. Um, so I also want to make it really clear that some of the next two slides that we're going to show and what I'm going to talk about, the changes that are that have been proposed with HR 1, most of them have not been implemented yet, which means that we have a lot of time to advocate to either stop them from being implemented here in California or make sure that the impact of those changes is as small as possible. And so it gives us room to advocate with our local legislators and make sure that we're being represented in those conversations. And one example with that is work requirements. That was one of the biggest things that came out of HR 1 in January, excuse me, in January of 2027. It will be required for adults ages 19 to 64 to show that they meet Medicaid work requirements. But we've also learned that advocates around the state are working with legislators and counties to make sure that there are checks and balances in place to make sure that recipients don't fall off of Medi-Cal. But some of these cuts include that California will lose around $30 billion in healthcare funding. That includes coverage for Medicaid, Medicare, and the Affordable Care Act. It will also kick an estimated 5 million Californians off of healthcare. And it directly funnels $170 billion into ICE funding. That includes $45 billion for detention centers, which is a 308% increase over its 2024 budget. It will also reduce access to emergency services for the 200,000 lawfully present immigrants who are no longer eligible for Medicaid money. And again, it will impose work requirements for undocumented immigrants to be able to retain full scope Medi-Cal. And it will make deep cuts in the in-home supports and services program by eliminating the backup provider system. And additionally, the IHSS residual system or program, and it will defund any new needs. So if someone were to have a condition that worsened over time, which often happens with age, their care with that increasing need would not be met, only the standard of care that is currently happening right now. And we know that this all sounds like really scary and it's a lot, but I also want to make sure that we are providing services and resources in case you have specific questions about your healthcare. So I would highly recommend that you reach out to our peer advocates. They are a very, very helpful resource, and they can connect you with the right resources and provide you individual support as well. A lot of our peer advocates are folks who are recipients of Medi-Cal and Medicare as well. So there is peer support available. And their warm line is 415-546-1333. And I can put that in the, oh, perfect. Okay. Continuing on to talk a little bit more about what the problem is and what is currently happening to our services. We know that some different groups of people have now become ineligible to receive Medicaid, and that includes humanitarian groups like refugees, asylees, victims of domestic violence or trafficking, and those who are granted withholding of deportation, and those paroled into the US for at least 1 year. And we know that without full scope Medi-Cal, people won't be able to go to the doctor when they are sick, except for in emergencies. Immigrants who have disabilities will rely on their family members to care for them with or without pay and support from the government. And as I said before, current consumers of IHSS, as their conditions worsen, they will receive the same level of care, but their condition will be worse and that support will not be there. Okay. And I also want to connect it to talking about how does this connect to our budget locally. Every level of government goes through their own budget process every single year. And what we've heard directly from Newsom is that the costs will be shifted to the counties. So for these that are being cut, we know that the state is going to ask our counties to front the cost. And our counties can't do that. Our counties are already cutting their budgets and specifically cutting programs that are for community. And so, in order to be able to handle these costs at the local level, we'll start to see cuts that are really significant and devastating. Um, and we're already seeing that here locally. There's currently projected millions of dollars that are being cut to community programs. I've heard just this week that there are a few different clinics around San Francisco that are set to close. And this is a direct result of HR1 and the state budget that was passed last year that requires counties to handle the burden of these deficits. And at SDA, we're facing our own budget cut at the city level. Many other communities and other organizations are facing far worse and even more devastating cuts. And this is a direct result of the federal government incentivizing and forcing other levels of government to balance their budgets on the most vulnerable rather than tax billionaires and corporations who could handle the cost.
Looks like we have a question in the chat. What's the IHSS residual program?
Yeah, so the IHSS like residual or backup provider program is basically if someone's IHSS provider is sick or unable to work for any reason, each county should, it's not all set up well, but some counties have the option that you can call and get someone sent who can be your IHSS provider just for that day.
Okay. And probably now would be a good time if there are other questions that you all have. I'd be happy to answer them. I know we just shared a lot of information. So I'll pause here for questions.
Can you read it? How does
The question in the chat?
what? 现在
Sorry, what was the question?
How does this connect to our budget locally?
Yeah, that's a good question. So the way that it connects to our budget locally is that all of these cuts mean that there's still a need for these services to happen, even if the program itself is being cut. And that means that our counties have to bear the burden of that cost. And unfortunately, none of our counties can handle that cost. What we're talking about is in the billions of dollars, and majority of our counties, if not all of our counties at this point in California, are in a budget deficit. So they're unable to provide new revenue sources to be able to fund this need. And in order to be able to continue funding the need, they've decided to cut other programs. So sort of pitting our communities against one another. Good question, though. Okay. But now let's talk a little bit about the solution, because this is all pretty sad, but it doesn't mean that we're without options, and it doesn't mean that we don't have any power. And that's exactly our role. It's to grow our people power, show a united front, and develop and support our campaigns. The picture that's on the slide right now is from a legislative visit we did in February at Assembly Member Matt Haney's office. He's one of our biggest supporters, and he's also an assembly member locally here in San Francisco. But we've gotten a few other ones, so we'll see a different pictures pop up throughout this of the legislative visits. But in the past, when we worked together, we've won. It was organizing in 2023 that achieved health for all by expanding Medi-Cal to all undocumented Californians. And in 2024, when the governor proposed cutting in-home supports and services from undocumented Californians, we successfully protected it. And then last year, when the governor proposed eliminating overtime hours for IHSS workers, which would have resulted in millions of hours lost and millions of dollars in paycheck cuts, we successfully protected that. And even just from our advocacy this year, from the legislative visits that we've done and the action hours that we've had, from doing phone baking, which we're going to do later, doing exactly that has been able to push the Senate to propose a budget that rejects all of the governor's proposals to cut in-home supports and services. They've also maintained full scope Medi-Cal for humanitarian immigrants who are currently losing federal funding. And it delays the loss of dental and additional premiums for undocumented Medi-Cal beneficiaries. And the best part is that the Senate's proposed budget will levy a tax on the top 1% to 2% of corporations to pay towards Medi-Cal costs. So what we've seen is that big corporations have a lot of folks who are on Medi-Cal, but they're not paying for that. They're not paying for their healthcare, even though smaller corporations are paying for their folks' healthcare. So we're asking for our highest grossing corporations to pay their fair share for their employees. So what are we going to do? And why do we think this will move our target? And what does the target care about? We need to continue putting pressure on the folks who have the power to change the budget. We've already moved the Senate, but we've not moved the Assembly yet. So we have to keep the pressure on if we want them to support our budget demands. And we elected them, so we can choose someone else if they decide to not defend our programs and services. And maybe you're asking, why now? The May revise is coming out in the next couple weeks, and we have the ability to push back. And we also have some momentum from the Senate. And now is the time to assert our moral authority. And the Assembly will be deciding in the next few weeks what their budget will look like. And we want it to look like the Senate's budget. And we know that May Day is in 1 week exactly. So a lot of people right now are talking about workers' rights and immigrant rights. And it's important for our community to know what's happening with Medi-Cal and IHSS, and to understand the connection between the money that's being taken directly from our healthcare that's being used to terrorize immigrants and give tax breaks to the wealthiest people in the United States. If enough Californians talk to their legislators, we will get the budget that we need. So if you're interested in taking more action besides today, a great opportunity to do that is next week for May Day, also known as International Workers' Day. It will be May 1st. There's a rally happening here in San Francisco. The slide says 1 p.m., but it should say 2 p.m., so I apologize for that. Yeah. We're meeting up at 1, so the march does start at 2, so I plan on arriving a little early so that you have time to find us. And the slide also says that we'll have a cable car available for folks who don't want to walk that distance. So please either let us know in the chat and we can follow up with you. Or if you're here in person, you can chat with us. Yeah, we've also got some really beautiful signs that we're working on that we showed in the beginning of the presentation. But this is a great opportunity to um, be with community and advocate at the same time and organize. And we'll be joined by a lot of other different community groups. So it's not just going to be us. Okay. But let's keep putting pressure on our legislators. So let's do some phone banking. So maybe now, actually, I can ask, is there anybody in the room or on Zoom who's done phone banking before? And if you don't know what that means, it basically just means all together, we're gonna call our legislators. We have a script ready for you, and we're just gonna do it at the same time. So yeah, if you want to raise your hand if you've done phone banking before. I know I've done phone banking before. I have a lot of fun with it. Yeah, most of the folks in the room have done phone banking. I see quite a few hands on the Zoom too. Okay, great, cool. Okay, so this is the script. It's a lot of text, but we'll also have it in the chat as well. And I have a physical version if you're joining us here in person. I'll leave this slide up once we actually get to the phone banking portion or like when we start. But I'm gonna move the next slide for now. And these are all the folks that we're gonna be calling today. I know that probably not everyone, their assembly member is these three different folks. So we've also included a link to find your own senator or assembly member. It's especially important if you know that maybe you might live in an area that's more conservative than other parts of the state, that you call your legislator because they're the ones that we want to push. They might be the person that's holding the budget back from being passed in a way that would be supportive towards our community. So it's really important if you live in a conservative area to call your legislator. Okay. So I see Grace put the script in the chat, and I think now would also be a good time if maybe one person wants to volunteer to role play a phone bank. So I'll pretend that I'm calling you the legislator, and I'll give you the whole spiel, and then it should be pretty quick. I see Sylvia's hand. Okay. Maybe no question then. Do you want to role play with me? Okay. So Shai is gonna role play with me. Do you want to be the legislator? Sure. Okay. So sometimes when you do phone banking, it's pretty rare that you would get the legislator. You'll most likely get whoever is working in their office today. Okay.
You unplug your computer for 1 second so it's more like
Yeah.
all right.
Ring, 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 ring. Hi, my name is Itzel. I'm a resident of San Francisco. I am calling to ask that Jesse Gabriel, Assemblymember Jesse Gabriel, stands firm against any further cuts that would impact seniors, disabled people, and immigrants affected by last year's budget cuts. I ask that the member push back on harmful Trump cuts and not impose work requirements on state-funded populations on Medi-Cal. I'm also asking for the member to support state-funded full-scope coverage for 200,000 lawfully present immigrants who are being kicked out of federally funded Medi-Cal by the Trump administration, and the IHSS backup provider system that allows recipients to continue to receive care. which is currently under threat because of Governor Newsom's proposed budget. Without this pushback, these people would only have access to stabilizing care in emergency situations. California's leaders must find sustainable revenue solutions to ensure all Californians have access to healthcare. Thank you.
Great. I will take your message and I will tell the assembly member.
Thank you. And that's pretty much it. That's pretty much how it's going to go. You'll give your spill, they'll record it down, and they'll say thank you. They'll say that we're going to pass it on to the legislator, and that's it. And then you can move on to your next call, and you're done. And you've taken action in a fairly easy way that a lot of people don't do, but it's pretty easy and kind of fun. So I'm going to pause here if there are any questions. Now would be a really good time to ask them. There's also emails too. So if you don't feel comfortable making a call, that's totally fine. We've included their emails as well. So maybe I can go ahead and read each one of them out before we get started. The first person you could call is Assembly Member Budget Chair Jesse Gabriel. His phone number is 916 319 2046. And his email is in the chat, but it's also assemblymember.gabriel@assembly.ca.gov. And the next person is the Speaker of the Assembly, Robert Rivas. And his phone number is 916 319 2029. And his email is pretty much the same. So it's assemblymember.rivas@assembly.ca.gov. And the last person we have for you is Assembly Budget Subcommittee on Health, the chair of that committee. Her name is Dawn Addis, and her phone number is 916 319 2030. And she's got also basically the same email, assemblymember.addis@assembly.ca.gov. And the link to find your own rep is find your rep, or FINDYOURREP .legislator.ca.gov or legislature.ca.gov. Okay. So please make sure when you do your calls that you mute yourself, or your emails. If you're going to email, you can make sure to mute yourself so that you don't disrupt others while you're making your call. And let's take maybe like 10 minutes for this. And I'm going to move back to the slide with the script. And if you need the numbers, they're all in the chat as well. Are important when I talk about. Okay, I know we just started the recording, so maybe I'll go back a little bit. Okay. So we're switching gears to talking about storytelling, which is another really effective way to make change. Um, of course, we can share facts and numbers, and that's super helpful. It's super helpful for us to talk about the specific amount of people who receive Medi-Cal, but it's much more impactful when I talk about specific experiences, or when we all talk about specific experiences and why Medi-Cal is so important and so helpful. But also by sharing our stories, we can build collective power with ourselves. Um, and with that collective power, we have the ability to shape the state budget and defend the services that keep us safe. But we also have the ability to connect one another and know what's going on in each other's lives and how this particular issue is impacting us. And by sharing our stories, we have the ability to demand commitment and change from our legislators, which is what our goal is by collecting our stories today. If we can move specific legislators by telling our stories, we have a greater ability to advocate for our needs and make sure that there is revenue to protect our services. So I'd love to maybe ask a question to the whole group. Um, maybe just raise your hand if you know somebody or you are somebody who receives Medi-Cal or Medicaid. I know people. I see 3 other folks or 4 other folks in person do. Let's see. Yeah, lots of folks online raising their hands too. Yeah, and I think with 40% of Californians being on Medi-Cal, probably most of us, maybe even if we don't know, but we probably do know someone who receives Medi-Cal. Okay. And maybe you're wondering, I still don't get it. Why are we sharing our story? What does that have to do with this? So our stories, like I said, can create more impact than sharing numbers and facts. It helps to build collective power, and it demands commitment from our legislators. And so, to kind of give you a feel for what it's like to share your story, I've prepared my own that might be helpful for you when we get to the point where you're drafting your own story and maybe recording yourself as well. So, I'm going to share my story now. Hello, my name is Itzel. I live in Oakland and work in San Francisco. I am a community organizer and I focus on healthcare, which includes Medi-Cal and Medicare. I have many family members who rely on both Medi-Cal and Medicare to receive the care they need, including my grandma, who was able to receive treatment and support when she was diagnosed with cancer in 2020. I want Medi-Cal and Medicare to continue so my family and community members can live well and independently. If my grandma did not have Medi-Cal, she would not have been able to afford expensive cancer treatments, surgeries, and ongoing screenings and medication. It would be very difficult for my grandma and our family if she lost her Medi-Cal. Last year, so many people that I care about were impacted by cuts and the government shutting down. And it was really scary. And I want to make sure that Medi-Cal and Medicare continue so my family and community members can live well and independently. I hope that by telling my story, it encourages you to vote against cuts to Medi-Cal and Medicare and support efforts to pass revenue measures to support vital healthcare programs. By taking action to defend healthcare, it will allow so many people in my family and community to live well and independently. Thank you for hearing mine and my community story. I hope you will defend Medi-Cal and support seniors and disabled people. Okay, hopefully everybody has the document ready in front of them. I know folks in person do. So I'm going to describe what the document is. So the template walks you through all the different parts that make up telling your story. You don't have to use this template exactly, but it'll give you a good idea of all the many things that you'll want to include and how to make sure that you're delivering your message effectively. So there are two parts to creating your story. There's also a section in the handout for you to write in your story. So it's that probably, I think, second page. That's just a big box. That's where you can go ahead and type in your story. And the first part goes over who you are. So you'll have a chance to introduce yourself, talk about where you live, and how you are a part of the community. But you'll also want to include what your advocacy goal is. So for me, I said, I want Medi-Cal and Medicare to continue so I can, so that my family members are supported and my community members are supported. But maybe your sentence looks more like, I want Medi-Cal and Medicare to continue so I can keep my care worker and continue to live independently. And the second part is about why your advocacy goal matters. This is getting to the heart of your story and how you're affected by these cuts. So for my story, that was thinking about what it would mean if my grandma didn't have Medi-Cal or if any of my family members lost the services that they rely on. After that, you'll share an important moment that shows how the problem impacts you. A good example might be from last year when HR1 was passed, or in November when SNAP and other benefits were paused for a month. And at the end, you'll also want to restate your advocacy goal from part one and share what you hope your story encourages the legislator to do. Okay, so now's the time that we can go into breakouts, and we've pretty much made it to the end. So I'm going to give some last remarks before we get into breakouts. So this is really putting your story into action. So what we're doing right now is recording or writing down your story for us to share with legislators. We're also hoping to get a story in the news pretty soon. So if you're interested in that, we would be happy to make sure that your story is heard. But you can also join us for legislative visits. So if you're interested in that, you can email me. My email is itzel@sdaction.org, and I'll make sure to put that in the chat too. And you can also become an SDA member and join our healthcare action team. We meet once a month, and sometimes we have meetings like this where we do quite a bit of training and action, but sometimes we'll just hang out with each other and talk about what's currently going on. Sometimes the meetings look more like having an action that's in person at City Hall. Yeah, so. And my last reminder is that you can also join us for May Day next week on May 1st. We're actually starting right across the street from the Disability Cultural Center at the Civic Center Plaza. That starts at 2 p.m., but make sure that you arrive a little early so that if you want to get a spot on the cable car, or a t-shirt from SDA or a sign from us, which we hand painted over the past couple weeks, you want to just arrive a little early. And you can email me for that as well. Okay, so now is the time that we'll go ahead and get into breakouts. If you're online, please make sure that you put in the chat whether or not you'll need interpretation, and we'll keep you in the main room. And if you're in person, I'll be here to help out. And thank you for attending today. I really appreciate you all taking time out of your day to hang out with us for a little while and take some collective action together. This is how change happens. We were, again, able to move the Senate, and now we're going to move the Assembly, and we're doing it today. So thank you, everyone.